Hey everyone, Dr. FJ. This is my friend and patient Matt. He's going to go through his story, how we use the NUCCA technique to basically fix his alignment and over time fix up his back problem.
Yeah, so I first came in to see Dr. FJ, I don't know how long ago, 6-7 months ago maybe, with some back issues, and I had tried some other things over the last year or two, from stretches to other adjustments, and I was getting temporary relief, but it wasn't anything that was sticking, at least as long as I had hoped. So I had a discussion with Dr. FJ, and he had suggested maybe we try this different technique that he does. I think it's called NUCCA, and we gave it a go. But I was at a point where I couldn't, I like to golf. I could barely tee up the golf ball. I would try stretching and all that stuff, and it just wasn't getting any better. So we came in here, and slow but sure, we got her fixed really good.
So Matt does a good impression of the NUCCA adjustment.
Yeah, so the first time I came in here, I didn't know what to expect, but I had to pause for a second and ask him what he was doing, because he'd stand over you and like there's a Jedi trick or something
Nice.
like that.
I feel better already.
Yeah. But it worked. I mean, the first time I was here, I was getting relief, but it wasn't. I mean, it was a gradual process, and after 2, 3, 4 months, I didn't even really realize I even had back problems anymore. So that was the important thing to note. There's always improvement, and you did get relief from the beginning, but it really was the commitment to follow through the technique that helped me out.
So it's a process, and we'll go through today. I'm going to show you Matt's x-rays. And basically what was happening is his alignment was off. He played college soccer, probably maybe from heading the ball or something else. But that was off, and it was blowing out his back. And that's why when he would get his back adjusted, he'd get relief, but it never lasted because you weren't fixing the underlying cause, his overall alignment, and how his body was handling and moving through gravity. So we'll go through, show you the x-rays, show you the posture, and show you the Jedi mind trick adjustment that we use. So we'll show you all that in a little bit. Okay, so we're going to check. We always start with the supine leg check, the supine basically postural analysis. And then you can come see Matt's out, so we are going to adjust him. You can see the difference in heel length. His right heel is probably about 3/8 of an inch shorter than the left. So that right away tells us he's out. We're going to then look at his posture, standing in gravity. So, Matt, let's have you sit up facing that way. So I like to always feel for tension. Good. And then just stand up. Around here. So with Schmidt's, no, you're good, you're good. We know with him he has a low right shoulder. We wrote that down. Can you see it from there?
Yeah.
So his shoulder and everything will shift when he's off. So he's off right now. We're going to adjust him. He's been holding now for probably 2 or 3 months. So this is the first time we've had to adjust him in a while. But we're going to adjust him, have him rest, check the legs, and then sometimes it takes a little while for the posture to correct. You got to remove the resistance, the tension, and then let the body kind of fall into place. So Schmitz, let's have you come. He's going to lay on his right side. Slide up just a little bit. Good. So how we block the head, how we set him up, all of that we get from x-rays and analyzing those. And then you can feel, that's why I really like the hand adjustment, you can feel the tension in the spine. We're just going to adjust them until we feel that tension disappear. The first time you adjust somebody, lots of times it can take quite a while to completely clear the resistance because it's been there for decades usually. But then after that, if they're consistent, usually 5 minutes or so, you can clear it out. Okay. So he's a high 3 3/4 with no rotation. So it seems simple and pretty easy. You can tell I'm sweating. I'm working pretty hard. Then you can sit up. The initial adjustment can take sometimes hours. You're there in the office to fix it. And that was, in that situation, that was pretty tight. So I won't have him go so long between checkups. But that feels a lot better. Let's have you stand up facing that way. Yeah. Still a little low. We'll give him a little time to rest. Check the legs. Go on your back. Yeah, come on, I'll show you the heels. The heels are pretty obvious, pretty apparent right away. You can see that right leg almost looks longer than the left now. So sometimes there's still some resistance in the spine after that. You need to keep adjusting, but with a little rest, his posture will probably fall right into alignment. We'll give him about 5 minutes and we'll check him again.